Vanakkam. One of the most demotivating things in a doctor's life is the occasional failure that we see. Look at these pictures. How many of us doctors have been in this situation at times when we faced failures? As surgeons, we have had failures, haven't we? In fact, we should have had failures if we are doing surgery. Yes, this mindset will be there momentarily because we wanted to do good for the patient, but it did not succeed. But we need to remember that this is a very fleeting and transient phase. We need to come out of it stronger than ever before. And we shall see how we can do that in this video. But what is failure? The Oxford Dictionary of Mechanical Engineering defines failure as the result when a body, component or structure is incapable of performing the task for which it was designed. This leads us to believe that failure is based upon what it is not, success. So, does that mean that failure is the opposite of success? In 1848, poet Anne Grenier, in the poem The Narrow Way, wrote that he that dares not grasp the thorn should never crave the rose. Surgeons train for most of their lives to adeptly wield roses that can be uniform or unique in nature. But there is no surgeon who has not felt the blight of a thorn. How should we react when we fail in the operating room? This will definitely upset us. But wait, I can show you how to turn this demotivating factor into something that will motivate us and take us further in life rather than push us down. First, we need to handle the basic problem. There was a particular situation or condition for which we conducted the treatment and it has failed. So the condition or situation is now not resolved. So that has to be treated first. It could have been a flexor tendon repair in zone 2. If the finger does not flex properly after the surgery, it can be called a failure. But when it fails, what we need to do is examine completely, analyze what is wrong and plan the corrective surgery so that the patient can get back function. If a microvascular free flap was used for reconstruction of a wound and it fails, that is, the flap necrosis, the first thing to be done is to correct the problem. If the failed free flap means a raw area, the lifeboat plan or plan B must be executed as soon as the patient is fit for the next surgery. This will ensure that the underlying problem has been corrected in spite of the failure. Next, we need to handle the patient who has had the complication. He must be told that the surgery done for him has not worked out as it had been planned. The acceptance of failure will usually go down well with the patient if dealt with in a calm and empathetic manner. So if a double toe transfer has been done for the patient, that is, we have taken 2 toes from his foot, hoping to construct 2 fingers of the hand which has lost all the fingers, and the transferred toes necrose, we need to explain to the patient, though we have already discussed these complications before the surgery. The next thing we need to do is talk to the attenders or caregivers of the patient. Even though the slim chance of failure and the need for revision procedures have been explained to the patient and the attenders before the primary surgery, it is important to again discuss the failure and the further course of action. This discussion should include the following points: the need for another corrective surgery, the need for a longer stay, and the need for an additional expense. After all this, we need to handle our colleagues and the administrators if they are involved. Our own colleagues in the hospital may come to hear of the failure. Some may be understanding, some may be plain sarcastic, and yet others may be cynical. It is best to deal on very scientific lines when dealing with colleagues. It is only when you try to hide the failure that they become cynical. Then your team members, they have a role in the entire procedure that you have done. They are also interested in the well-being of the patient and the success of the procedure. The morale of the team must be maintained and not allowed to sag. Discussing the causes of failure with the team will help boost morale. Finally, you have to handle yourself also. Apart from carrying out the alternate procedure to correct the problem that has failed, apart from talking to the patient, the attenders, dealing with your colleagues and team, you also have to handle the stress because it is your responsibility ultimately. Do not avoid meeting the patient or attenders. In fact, it would help if you speak to them directly. And do not blame others for the failure. Apart from all this, you need to work on your mental well-being also. Life in general and life as a surgeon is a roller coaster ride. We all experience moments of success and happiness as well as occasions of failure and sadness. Furthermore, people often fear failure, and when this experience comes about, they do not have the proper tools to cope and move forward. So, we need to come out of that failure mindset and use it as a stepping stone to success. You need to follow the 6-point program to de-stress yourself. The first and most important point: accept your feelings and emotions. Failure is linked with sadness, anxiety, stress, rage, and so on. Those feelings are incredibly uncomfortable for any person, and he will do anything to get rid of them. However, the truth is that those feelings and emotions will help you work harder to find different and better solutions in order for you to improve next time. So go ahead and embrace those feelings and emotions. Avoiding them can lead to unhealthy coping mechanisms. The second important point is that you need to understand that failure does not mean your life is going to be over. Many people believe that failure defines who you are and your future. That statement is not true at all. Failure is what happens to you and not what is you. We all fail in life, in different aspects of life, for instance, job experiences, love life, getting into a university and other things. You do not need to let your failures define you. That is completely optional. I'll give you a good example of a person who has risen from failure. Can you imagine your childhood without Disney? Well, it could easily have been not present at all if Walt Disney had listened to his former newspaper editor. The editor apparently told Walt that he lacked imagination and had no good ideas. Undeterred, Walt Disney went on to create the cultural icon that bears his name. Disney's take on failure is also interesting. He says, "I think it's important to have a good hard failure when you're young because it makes you kind of aware of what can happen to you. Because of it, I've never had any fear in my whole life when we have been near collapse and all of that. I've never been afraid." Now that you have decided to come out of this failure, go on to step 3. Learn from the failure and be constructive. Failure is one of the biggest challenges and lessons you will have in your life. Understanding what you did wrong will help you to become mentally more potent than ever and establish specific goals with astonishing strategies. You fail and you learn. You fail and get up again. You recuperate, you get ready to stand up and achieve your goals. And to help you learn better from your failure, go on to step 4. Find inspiration. Get out of the place you are right now and forget your failure. Most of the time, when individuals find inspiration, they forget about the past and become motivated and go into the future. If you find yourself inspired, no one or anything will stop you. It definitely helps to get you out of your own mind and focus on outside sources of information which will give you a newfound perspective. And while on rebuilding yourself, be passionate. An answer for failure on some occasions may have a connection with lack of passion for something. Otherwise, if you're passionate about something, you will be motivated and put a lot of effort. Be passionate about something you love and not because of what is imposed on you by others. And finally, surround yourself with positive people. Your environment can make a huge difference in how you confront and cope with failure. Surround yourself with people who motivate you continuously. Your mind is dealing with stress and anxiety. So the best way to not have another burden is to be accompanied by positive people. At this point, I would like to invite your attention to this editorial by my good friend Dr. J.P. Hong from South Korea. The editorial is captioned, "Failure is a failure if you learn nothing from it."